Thanks for coming in today. We're going to do your yearly review. Okay. First of all, thank you so much for being such a great team member. We love having you here. What do you think some of your greatest accomplishments were this year?
I would say leading a successful code. The nurse noticed something was wrong, and we called the code. And there was good teamwork. Everyone had clear roles. There was clear communication, and it was successful.
Oh, good. Good. That's always great when they're successful. Let's go over this performance evaluation. I can see here that we were pretty on the same page for most of these items. Your commitment to your patients is fantastic. We get lots of nice reviews from you, or from the patients about you. You have great teamwork. For communication, I scored you as exemplary. I've seen you over the last couple weeks give great handoff reports, bedside reports to your oncoming nurse. You go into great detail. You make sure the patient's involved, and in case you miss something, you always check with the patient, see if they have anything to add, and that's always a great thing to do. So good job there.
Thank you.
Conflict resolution. Conflict is hard for everybody. So I can see, I rated you as approaching. That needs a little bit of work, but I think we all could use a little bit of work on that. If you have any problems with any coworkers, feel free. My door's always open to come in, and we can help tackle those things together, okay? High integrity. I think that you have a solid performance there. Adapting to change, you also rated yourself approaching. We both, sometimes change is hard, but as a nurse, we have to kind of be flexible and adapt to things that don't always go as planned. So something that, but I like that you recognize that and that you're working on that. So good for you. Respect for everybody, great respect. Safety. I did rate you as approaching. I did notice a couple things over the last couple weeks. Just be mindful when you're near your workstation, even if you're in a patient's room, to sign off the computer before you step away. Like, even if you're walking them to the bathroom and you're in there for a little bit, you leave that open for somebody to come in and tamper with it, and that's your name on that record. So you want to make sure that you always sign off to protect that patient information, okay? And then also, when you are changing a dressing on a patient, if the garbage is almost full, make sure you're not trying to compress it. Just change the garbage. It doesn't have to be overflowing. Just change it, get a new bag. You don't know what's in that garbage. If you stepped on it, you can contaminate yourself, you can injure yourself, and then you're spreading those germs throughout the hospital. So just be very mindful of that too. Okay, and your efficiency is getting there too. Perfect. Let's see. Like I said, your communication is very effective, and you can switch to the other page there. Just in summary, your handoff reports are thorough and give the oncoming nurse a clear picture of the patient. Your SVAR reports to the provider have been very good regarding apparent patient change and condition. They're concise. You give clear recommendations and advocate for appropriate orders. It shows knowledge and confidence, which is great. Your teamwork and integrity are solid and consistent. You're level-headed and a great teammate and coworker. Your fellow workers really like you. You have a positive attitude, and that's always refreshing in an environment like this. So keep that up. And I can see difficulty or change is difficult for you, but over the last few months, you've shown growth and willingness to learn new ways. So good for you. And like I said, the areas for further development are keeping patient information secure and confidential, and just the dressing change, keeping everything clean, including yourself, okay? As far as job-specific expectations, Let's see, always have a positive attitude. Communication is good, exemplary there. Completions of assignments. Sometimes you don't always get your work done in the full day. If you have a problem with that, just let me know if I can help you in any way. Okay, because we don't want you to have to stay over, longer than you need to. So, and your skills are up to it. You're always punctual and on time for handoff reports and meetings. Your attitude in high stress situations is one of competence, positivity, and respect, which is great. You have patience with new staff and students, so that's really nice that they feel welcome, which I appreciate too. This is a sign of a developing leader. So I really hope that you think about in the future advancing your education, because I think you would be a great leader. And you're always willing to learn new skills and help. So as far as medication administration, don't forget to scan your IV fluids, because that's always one that's easy to forget. IV fluids in the patient, so that they get credit for that. Okay, your time management is developing, and you're working on your charting. So good job there. Do you have? Let's see. So overall, I would say you have solid performance, which is good. We can always work on time management and delegation, okay, to be able to let you get your charting done. Areas of growth that I noticed. Do you have anything that you hope to accomplish this year?
I want to further my education and start my bachelor's.
Oh, that would be great.
I know, and then I want to become a mentor to other students and help them learn.
Oh, good. That would be great. We could get you signed up for that mentorship program, because we always have students every year, so that's good. Okay, so yep, I put as a growth area, advancing your education. I think you'd be great in the RN to BS program, and the company does have a tuition reimbursement program, so I can help you get information for that as well. There's also certifications that are available to you, like advanced cardiac life support, the ACLS, or PALS for kids, if you're interested in that. And then there's always committees that we're looking for people who are want to be engaged in the organization. Okay. Another growth area would be to improve charting and time management. Try to get those done at the end of every shift. And by delegating those tasks, I think would help you have more time. And then just focus on patient and staff safety. Ask questions when you're unsure, and reduce the potential for HIPAA violations. We just want to sign off that computer when we step away. Do you have any further questions for me?
I don't think so. I think you covered everything.
Yeah. How do you feel our evaluation went? Do you think that we're pretty in alignment?
Yes.
Okay.
Yeah.
Great. Thank you so much.
Thank you.
It's a pleasure having you.